The incidence of gestational diabetes is 2 to 10% of our population, and that is why it is so important to discuss it. I am Dr. Anita K. Sharma. I am Senior Director and Head in the Department of Obstetrics and Gynecology at Max Hospital, Vaishali. So what is gestational diabetes? Gestational diabetes is the term we use when a woman who had not been diabetic prior to her pregnancy develops diabetes during the course of her pregnancy. Over my 40 years of practice, I have encountered many patients with gestational diabetes, and the problem seems to be getting more and more prevalent. And that is why there are so many questions that have been asked over the years, and I want to talk about it. One of the most common questions I get is, what puts a person at risk for gestational diabetes? So what I would say is, a strong family history is one of the leading risk factors, followed by obesity and a poor lifestyle. So these are the two issues that push your patient towards gestational diabetes. Many a times I have been asked a question, is gestational diabetes permanent? The young women who ask me are in a state of anxiety and anguish. Well, let me reassure you, this condition is only there for the duration of your pregnancy. As the name denotes, gestational means pregnancy. It is diabetes that occurs during your pregnancy because of your pregnancy hormones. Once the hormones are withdrawn, you will go back to normal. So please do not be anxious and continue with the treatment as advised by your doctor. There is this general assumption that diabetes is only a disease of the obese and a woman who is thin-built cannot have diabetes. But this is not so. Sometimes women have a genetic predisposition, and even very thin women have found to have diabetes, though it is not common, but it is possible. So we cannot overrule diabetes because a woman is not obese. It is still a possibility. Another question that my patients ask me is, since I have developed gestational diabetes, what does it mean for my future? So well, if you have developed gestational diabetes, this is like a wake-up call. It means you do have a predisposition, and when you are in your 40s and 50s, there is a higher chance than the general population that you may develop diabetes. So this is the time to change your lifestyle, to change the way you eat, to change the way you exercise, so that you do not develop diabetes later on. The soon-to-be mom is very anxious about her baby once she develops gestational diabetes. Is my baby going to remain all right, is what she asks me time and again. Well, yes. Because of gestational diabetes, there are bound to be some problems. The babies tend to be larger. They tend to develop jaundice. They tend to develop hypoglycemia, which is a low blood sugar in their early neonatal phase. But all of this can be dealt with. What is important is to keep the sugars in control during the pregnancy period so that we do not face all these problems in her neonatal phase. So we've talked of so many other things, but as a doctor, I need to talk to you about treatment. So once a patient has been diagnosed with gestational diabetes, it may be mild or it may be severe. In those patients who have a mild case of diabetes mellitus, what we do is lifestyle management. Now, lifestyle management has two components. One is that of diet. The dietitian is going to tell you what to eat, when to eat, and what to avoid. And the second is exercise. So of course, all the exercises may not be possible in pregnancy, but we will tell you what to walk, how long to walk, what yogas can be done so as to keep your lifestyle optimal. Then there are some patients who have even more severe diabetes that may not be managed by lifestyle alone. In those cases, we can add medicines, and in some cases, we need to add insulin. We always have with us an endocrinologist who can guide you on the use of insulin. I know it is a very anxious time for the mother. So many times they don't want to take insulin, but if it is needed, and it will be helpful in the long run. We have talked a lot about gestational diabetes, but let me talk something positive now. What is important is early detection and management. And if we do both these things, then both the mother and the baby will emerge victorious. And this is what we want for you. I hope you found this video informative. If so, please like it. If you have any questions, then please do comment below. Thank you.